Welcome to BIV Today, the daily podcast from the newsroom of Business in Vancouver. I'm Kirk LaPointe, publisher and editor-in-chief. This week, BC imposed measures to curtail activities to deal with the rising caseloads of COVID-19. It closed the Whistler Blackcomb Resort. It barred in-restaurant dining and bars. It banned group fitness classes and decided not to lift restrictions on gatherings and places of worship. For 3 weeks, these measures are going to be instituted. There is a larger picture, though, that's emerged about how provinces have contended in the last year with a mixture of restrictions and allowances on mobility and economic activity. And a study this month from the Blavatnik School of Government at Oxford University and the Centre of Excellence and the Canadian Federation at the Institute for Research on Public Policy in Montreal looks at the divergent approaches and what works best and worst. I'm pleased today to have Charles Breton, the Centre's executive director and one of the authors of this report, with me. Good to see you.
Hi, good to see you too.
Well, we're now, I guess, into wave 3 of this, but I want to get a little bit of a gauge from you on how waves 1 and 2 have gone as responses by the provinces and territories. We're about a year in now, or more. What did we do well, and what not at first?
That's a good question, and it's important. And I think as we reflect upon on the last year, I think it's important to remind people that wave 1 and wave 2 of this pandemic are completely different beasts, both in terms of the cases and where they were and the number of cases, and in terms of the measures that provinces put in place. So in terms of cases, when we compare that, many provinces did not really have a wave 1. It was mostly Ontario, Quebec, was mostly limited to long-term care homes. There was some community cases, but it was mostly an LTC issue, and mostly in Ontario and Quebec. Other provinces did have cases and did have deaths in some of their long-term care homes facilities, but not to the same extent that Ontario and Quebec did. But the interesting thing is that in that wave, in wave 1, we tend to forget it's a year ago, but all provinces kind of reacted the same. BC is a bit different, but most provinces reacted the same to that first wave, even with limited number of cases, which is they closed down everything. They closed schools, they closed restaurants, they limited a lot of things. Couldn't even go to the park and play with your kids at the park at that time, right?
Yeah, no, I saw a picture this morning of from a year ago of a playground with police tape around it.
Exactly. So we tend to forget that, but that was the situation in many places last spring. And so that was wave 1. And then everyone kind of reopened in the summer to a different extent, but everyone kind of reopened. And it's really when wave 2 hit in the fall that we started seeing variation in how provinces reacted to cases. That's where we started to see innovation in the kind of measures that provinces did. Again, wave 1, everyone kind of did the same. Wave 2, you saw provinces like Manitoba, which had really a large increase in cases in the fall, coming up with like a rule that you could only go in retail store and buy essential goods. And then they had to come up with a list of what an essential good is. So that was kind of new. And then Quebec kind of copied that later on in the winter. And so you saw all those varying responses to wave 2 with Alberta and Saskatchewan responding kind of late to increases in cases. Quebec and Ontario, Manitoba responding maybe more swiftly to an increase in cases. So really different, both in terms of what constituted the wave 1 and wave 2 and how provinces reacted to it.
Yeah, I saw a picture this morning, from a year ago, police tape around playgrounds, that
exactly.
kind of thing.
Exactly. Yeah. So you couldn't even use playgrounds. Schools were closed. Restaurants were closed. Everything was closed. Not everywhere, but in many places. And many provinces never went back to measures as stringent as they were in March, April of 2020, even if cases were not there wasn't as many cases. And then you saw everyone kind of reopened in the summer to different extent, but everyone kind of reopened. And then it's really in last fall of 2020, that we saw a lot of variation in what provinces did. There was a lot of variation in cases as well, but even how provinces reacted to kind of the same level of cases. Some provinces responded quickly, others waited longer. Some provinces, everyone kind of agreed that closing schools was not going to happen anymore. which was the reaction that everyone had in the spring. But in the fall, everyone kind of decided that they were going to try to keep schools open, sometimes with kind of varying schedule and all that. But it was clear that a complete shutdown was really something that provinces wanted to avoid. But all kinds of other measures. For instance, Manitoba was dealing with a lot of cases in the fall. It was the province that had the most cases per capita in the fall. And they really came in with super stringent measures, including one that seemed weird at the time, which was you can only go to stores, retail stores, to buy essential goods. And so people were like, okay, but what is an essential goods? So they had to come up with a list. Right. Yeah. So that's the first province who did that. And then Quebec copied that later in the winter. But that's one example of kind of the variation. They did that. Saskatchewan did not do that. Alberta did not do that. Ontario, not necessarily either. Right. So you saw a lot more variation in what provinces did in the second wave. And then we'll see what happens now with this third wave kind of just getting started.
Yeah. So what I'm kind of wondering about is, this is a federation, and so all these different jurisdictions, and of course, not all of them get along. But what prevented us from having a kind of a national approach on this one, Charles?
So, I mean, that's a good question, and I've been asked that question many times. My first intuition is always to say, why would that have been better? That's the first thing. Like, why would a national approach would have been, in theory, better than what we did? I'm not sure that's the case. But the one thing I'll say though is that federalism, in a case like this one, when faced with an issue like a pandemic, federalism does have some advantages and some disadvantages. One advantage that it has is that, again, provinces can respond to their own context, to what's going on in the province at the time, right? And so for the same reason that even provinces kind of tailor their approach within the province by region, because not all regions in the province are faced with the same kind of cases, so they tailor with color-coded regions or whatever. It's the same for Canada as a whole, right? So not all provinces are faced with the same kind of context. Nunavut is not Saskatchewan, or is not PEI. And so it makes sense for provinces to kind of react to their own context. Also, federalism allows provinces to innovate, to come up with new measures that other provinces might not have thought of, allows provinces to copy each other if something seems to work, right? So Quebec was the only province to introduce a curfew, which I'm still living under right now in Montreal. I cannot get out of my house after 9:30. It was 8 p.m. In January. That measure, Quebec was the only province to adopt that. It was not copied by other provinces, but it seemed to have worked here. Might not have worked elsewhere, for instance. So that's one of the advantages of federalism. Yeah, were you gonna?
But your report actually does say that it doesn't look like the benefits of federalism were quite leveraged here.
So I was going to say there are definitely some disadvantages. First of all, federalism requires a high level of coordination and cooperation and discussion that I'm not sure was always there. I mean, of course, public health officials talk to each other, and I don't think we've ever seen, at least at the executive level, as high the number of relations and the number of phone calls and the number of discussions that we've seen this pandemic. I don't think we've ever seen that before. Like people were talking to each other, but in terms of coming up with solutions, in terms of coming up with measures, in terms to that kind of disentangle, we didn't see the level of coordination that could have been helpful. Again, I think there is a balance that we need to find between letting provinces respond to their own context while still allowing them to collaborate and coordinate on some measures. And the Atlantic bubble in that instance, for instance, is kind of a blueprint for something, because each province was still kind of able to tailor its response and adopt this and that measure, but there was still kind of a level of coordination at the level of the bubble that allowed them to control the cases. Of course, this approach might not be, I don't think you can take it, and it cannot travel necessarily to all provinces, but there's something in there that we didn't see elsewhere. For instance, everything that is related to interprovincial travel between Alberta and BC, right? It was more of a conflict than a cooperation there, where there could have been more of a mutual approach to that.
Yeah. Did you notice really the temptation of economic activity very, very high in the country? Was that really one of the factors that prevented us in a lot of ways from suppressing this?
I mean, there's also kind of a different, I would say that province to province, there might be somewhat of a different weight put on restarting the economy as soon as possible, which prevents kind of that collaborative impulse, right? So if one province really wants to get restarted, even if cases are kind of not going down that much, and then the other wants to be more cautious, then it's kind of hard to get together and figure out something. So in that respect, I think you put your finger on it, that provinces' willingness to reopen and when faced with cases, or provinces trying to be more cautious, definitely puts an added tensions in how they collaborate together.
So let's kind of move past the first wave, because the first, as you're right, the first wave hit some and didn't hit others. My inference at the time was that if you weren't hit by the first wave, you didn't think a second wave was coming to you.
Absolutely, yes.
You were going to get past this. I mean, mathematicians and scientists will largely say, no, if you don't get the first wave, a second wave probably will hit you. But so what did we learn from the first wave? And what worked and didn't in the second one then?
So BC here, I think, is a good example. In the first wave, I think people always looked at BC and was like, what is BC doing differently? Like, why is it doing so well? And some of the answers were like, well, look at the approach that Bonnie Henry is taking, right? She's suggesting what people should do. She's requesting that people do X or Y, but there's no rules put in place, right? It was more of a discussion, and it's a suggestion and recommendation, and it seemed to work well. So maybe that's it. Maybe if you hammer people with rules, they revolt or whatever. They don't respect it, right? So they were pointing to that. Well, it turns out that works when you don't have a lot of cases. I think the causality was the other way around. Right. Where now you see it, like, that doesn't work anymore in BC, and then now BC is doing what every other province is doing, which is to ramp up the measures. I think that when we look back on this and we study those waves, the lessons will be different just because the waves are different, right? So the lessons on wave one was really what kind of a mess long-term care was. And that's where like all the deaths were in most of the cases were in wave one, especially again in Quebec and Ontario. I think this is really, wave one will need to be studied as to what to do and what not to do in long-term care homes. BC clearly had a much better way of dealing with its long-term care homes, was able to limit the damages there, especially in terms of how people working in long-term care homes travel from one home to the other, things like that. Wave two is much trickier. And here we hope, and that's another thing that I talk about when I'm talking about these data and this paper, is that most of the people who worked on this project, whether at Oxford or at the IRPP, were mostly political scientists or policy people. And so we hope that this data on each of these measures over the whole pandemic period, which are publicly available, are used by health officials and health researchers and epidemiologists to really look at this second wave, where there was a lot of variation in what provinces were doing and a lot of variation in the number of cases, and look at what worked and what didn't, right? With more sophisticated analysis. You can eyeball it somewhat, right? And kind of say, okay, Manitoba acted when it needed to act in October, November. Alberta and Saskatchewan waited way too long in the fall to act. So you can eyeball it, but I think what we'll need to happen, looking back on this wave two and possibly wave three as well, the way it's going, is to really drill down on each of these individual measures that provinces have enacted and see which one of these really had an impact and which one of these in the end was just fluff. It was in there, but it didn't do anything.
Do you think, is there kind of a best of breed kind of thing that's emerged out of all this? Is there something that appears to almost universally work in the way of concerted public policy and health policy?
I think it varies a bit from province to province, but I think that right now, the message that we're kind of getting more and more from epidemiologists and people working on this is that the issue is really where people are meeting in close quarters. So every measure that will stop people from meeting at other people's home will be helpful. So here in Quebec, the curfew, and that was the reason for the curfew, was that it was the easiest way to make sure that people couldn't meet with other people inside. You cannot get out of your house after 8. And now I think it's kind of a consensus that it worked, that Quebec was able to curb its cases in the winter in big part because of the curfew. I'm not sure it would have had the same effect everywhere, but here I think now it's kind of a consensus that it worked.
Yeah. You're a PhD in political science from UBC, so give us your gauge on how BC has fared.
So again, I think how BC has fared so far, the answer is very well. But I think that the answer on BC, the real answer, we will get in the coming weeks, coming months, because it's now. I think this is now when we'll see whether BC deals with what's coming up well or not. The variants are coming up. Cases numbers are coming up, and this is really where things can be. Sadly, this is when we can really tell whether the provinces handles it well or not. It's also interesting that, again, if you look back on wave 1, people were all adamant that and pointing out how the messaging coming from Bonnie Henry and Adrian Dix was clear, that things were communicated well. And then all of it, that's easy when you don't have a lot of cases. And then when you start to have those cases and you start also trying to regionalize, having color-coded regions or trying to tailor the approach to what's going on in zone X or Y, every province, when it got to that point, all of a sudden, oops, the messaging was not as clear and there was more confusion. And BC was not... did not avoid that.
Yeah, I don't know whether your ambit in studying and all this extends into the kind of sense of personal frustration that people have, and of course their mental fatigue in obeying some guidelines and even rules for a year now. But what worries you about the exceptions that appear to be taking place here and elsewhere in the country, where people are just saying, I'm tired of being told what to do. You're inconsistent. Guess what? Like I'm just not going to pay a whole lot of attention to you day by day anymore.
Yeah, so there's two things here. First, we did do some preliminary analysis, and I know that other people have worked on something like this, looking at trying to get some kind of behavior measures as to how people were following or not, using mobility data from Apple or Google or whatever. And so far, it does look like across the country, like it had an effect. Like people were indeed limiting their movement in response to the measures. So it's not that people were not complying with them. I think overall, and we cannot say here's a province where people did not comply and here's one where they complied better. I think across the board, people in general were complying with the measures. But again, it's been more than a year now, and if the vaccines are not ramping up, and if cases keep going up or even stall, if we get a plateau and the measures need to stay in place with the summer coming up, it's not going to be easy. I mean, everyone is just tired of this, and really looking forward to being able to see family and friends.
Yeah, I mean, last area. I mean, we seem to be in a race right now between the vaccines and the variants, right?
Yes.
And like in terms of what we're going to get, or how we're going to do in all of this. What kind of lessons from the first year you think are valid for policymakers to apply now that we're into the second? in terms of engendering the best behavior here?
Yeah, so I think it's still a bit early to tell, but what I would say though is I think again a lot of it comes down to the messaging. I think if you're that's one of the problem with maybe moving too fast on reopening is then you start doing the yo-yo and people don't know what foot to stand, right? So I think I would be much more careful in reopening, even when things are going a bit better, just because you don't want to open, close, open, close, open, close. That's when people at some point just get tired of all this, right? Because there's no rhyme or reasons to they feel like there's no rhyme or reason to what you're doing. So that's one. I think the yo-yo is also making people confused. Again, the color-coded kind of tailored approach by region adds some confusion. So there's a lot in the messaging I think will also need to be studied. And it's also interesting, and I know some people are working on this right now, how from province to province, who is the voice of those measures behind those measures has varied a lot, right? So in BC, it's Bonnie Henry, and Adrian Dix is there most of the time. In Ontario, it's Rob Ford. Here in Quebec, it's everyone in the sense that it's always the premier, public health official, and the health minister. And so you've seen, and in Alberta, it's varied. Sometimes it's Dina Enshaw, sometimes it's Jason Kenney. But province to province, who is the voice of the measures has varied between the political and the public health officials. So how that impacts the clarity of the message or the reception of the message will be interesting to study.
I should ask you, because I think you're in the cohort that the premier talked about. When the premier basically tells people in the 20 to 39 cohort, don't blow it for everybody else. Good message?
I don't think so. I'm in the court until next week, but yes. No, it's really not. And I think he tried to walk that back somehow just a bit later on. Again, I don't think you want to start. I think it's clear though on some activities, right? So like, again, don't go in other people's house, right? So I don't think you need to single out an age group. I think you want to tell people clearly what they shouldn't do and what they can do, but I don't think you need to go in and point to a specific group who's doing something or not doing something.
Yeah. Look, fascinating research that you're on top of here. This must be quite a time to do research and in all this. This is very fertile ground. I want to thank you for your time today, Charles.
It was my pleasure.
Charles Breton is the Executive Director at the Institute for Research and Public Policy. I'm Kirk LaPointe. Thanks a lot for watching BIB Today. We'll see you again.